In this video, we will learn about pharmacology, drug, dose related terms. Pharmacology is the science that embraces the knowledge of the history, source, physical and chemical properties, compounding, biochemical and physiological effects, mechanism of action, absorption, distribution, biotransformation and excretion of drugs. It is also defined as an experimental science dealing with the properties of the drugs and their effects on the living system. This is nothing but the effects of drugs on their living system and study of their properties of the drug. Pharmacology. Then comes to pharmacodynamics and pharmacokinetics. First we will learn about pharmacokinetics. Then imagine kinetics is related with motion or movement. To produce any motion, there must be a force behind that. At the same way, when we introduce any drug inside the body, our body acts as a force behind the action of that drug. This is simply to conclude what the body does to the drug. This is pharmacokinetics, the study of the actions of the drugs in the body over a defined period of time. It deals with the absorption, distribution, biotransformation and excretion of the drug. Pharmacodynamics is the study of biochemical and physiological effects of the drug and their mechanism of action. It is the response of the organism to the action of drug in absence of the disease. Pharmacodynamics is what the drug does to the body. Here, to conclude this, when any drug we injected in an system, here the system will have certain actions and reactions against that drug. To say what is the drug doing to that body, how the biochemical and physiological effects of the drugs and their mechanism of action on the body is going on. This is the study of what the drug does to the body, while the pharmacokinetics is what the body does to the drug. Pharmacomatrix is the study of techniques used in the measurement of drug effects to the administered dose of the drug. Here, it is the study of techniques used in the measurement of drug effects to that administered dose of drug. Means if we use a 5 ml dose and also a 10 ml dose, when we introduce 5 ml dose, there are certain effects. At the same time, when we induce any 15 ml dose, at the same time it also has several effects. Means there is a relationship between the amount of dose and the effects it produces. Means how the drug varies, at the same way effects also varies. So study of this variation of the effects and the variation of dose, this is related with the pharmacomatrix. Pharmacogenetics, as the name suggests, it is the study of genetically determined variations in animals that are revealed by the effect of the drug. Whenever we introduce a drug into a living system, that leads to reveal of the genetically determined variations in that animal. This is related with pharmacogenetics. Pharmacogenomics, this is the broader term. This is the term describe the use of genetic information to guide the choice of drug therapy on an individual basis. Means when we want to cure any disease, we are going to search on or research on that individual where we have to give the drug. Means it is used of the genetic information to guide the choice of drug, which drug we have to be used to treat that disease in that particular individual. This is differ from individual to individual. Our genetic makeup is differ from others. Means what drug are acceptance to the our system, this may not be useful for the others. Here, therefore, there is a need of study of genome of individual so that we can use a better choice of drug therapy. This is nothing are related with the pharmacogenomics. Genome. Here, pharmacoepidemicology is the study of drug effects at a population level. When there is a word epidemicology is comes, it is related with the population level. It is not at individual basis. It is concerned with the variability of the drug effect between individuals in the population and between the population. Here, in population, within the population and between the population. Means when we introduce any drug into the whole population, then there is a different effects are there. This population may show some certain effects and also that population may show certain effects. This is the study of the variations of the drug effects in at population level. This is known as pharmaco Epidemicology. Pharmacoeconomics. The aim to quantify in economic terms the cost and benefits of drug used in therapeutically. This term is very important because whenever we are making or preparing drug, there must be a concept of cost and benefit. We have to be careful in while preparing that drug in terms of economic benefits. The term, it is related with the cost and benefits of drug used in therapeutically. Pharmacy is the science that deals with the preparation, formulation, manufacture, standardization, preservation, and dispensing of the drugs. The term pharmacy also indicates the place where drugs are dispensed or sold. As we all know, this is easier term, pharmacy. This is normally used term. This is the place where the drugs are sold, and the main function of that pharmacy is to prepare, formulate, manufacture, standardize, preserve, and dispense the drugs. Then pharmacognosy, the study of the source of drugs, also deals with the physical chemical properties of the drug. Where from that drug comes, means it is the animal origin or plant origin or synthetic. Study of that is known as the source of the drugs. Study of source of drugs, that is pharmacognosy. I have an assignment for you. The people who are watching this, can you comment who is the father of pharmacognosy in comment section. And next term is materia medica, is an absolute didactic subject that was concerned with the pharmacy, physiology, and pharmacognosy and indications for the therapeutic use of the drug. The whole term in that there is a collection of the effects of the drug and their use, that source, what are that effects of that drug. That is the study of the materia. That is the study of the drug which include in the materia medica. And please comment in comment section that who is the first prepared the materia medica. The person who prepared first or true materia medica, comment in comment section. And metrology is the study of weights and measures as applied to the preparation and administration of drug. Here metro is related with the measurement, is the study of weights and measures as applied to the preparations and administration of drug. How much quantity we have to administer, how much quantity we have to prepare a drug. This is all related with metrology. Then chronopharmacology is the study of how the effects of drug vary with biological timing and endogenous periodicities. Here, when we introduce any drug, it have a different effect on going biological timing. It have certain effects on, its effect is depend on time. At initial level, it might have certain smaller quantity of effects. As the time passes, it may increase and finally it goes down. This is the nothing but the chronocology or chronopharmacology. Here pharmacovigilance is the science and activities related to detection, assessment, understanding and prevention of adverse effects of any other drug related problems. Here this is related with the totally to prevent the adverse effects of any other drug related problems. This is dealing with the pharmacovigilance. Pharmacoepidemicology is the study of the use and the effect of drugs in large number of people. It's not at individual basis, at the large number of people. The pharmacoepidemicology is the study of the use of and the effects of the drugs in large number of people. This is about today's class. In next we will discuss drug related terms and dose related terms. Please comment in this section who is the father of pharmacognosy and who invented true materia medica or first materia medica in comment section. Thank you.